So, what are the best acupuncture points to treat Parkinson's disease? As with all Western diseases, we need to differentiate presentation according to acupuncture diagnosis. Number one, we need to identify the implicated acupuncture channels. And number two, we need to determine the nature of pathogen. Only then can we select appropriate acupuncture channels and points to treat this syndrome. A list of common symptoms will help us at least partially identify affected acupuncture meridians and the nature of pathogen. A typical presentation of a person with Parkinson's disease is a tremor or shaking of the limbs. They also have slowed movement, muscular rigidity, impaired posture, and balance issues. Parkinson's disease is a progressive neurological disorder that affects the brain. The brain we call the sea of marrow in Chinese medicine, and the dumai, the governing vessel, goes through the brain. The dumai is also responsible for the balance and the upright position. Besides, Parkinson's disease is a chronic, debilitating syndrome, so it affects the UN constitutional level. It requires the involvement of the 8 extraordinary meridians. Tremor or shaking of the limbs is a symptom that we call the internal wind. We say internal wind comes from the insufficiency of liver yin, which cannot control liver yang. The yang qi separates and moves through the muscles and ligaments because the liver controls the sinews. Thus, people have shaking and also muscular stiffness. Foot taiyang bladder channel controls standing upright and walking. When a person cannot stand straight or especially walk, foot taiyang bladder channel is implicated. To sum it up, we identified the du, liver, and bladder channels as the main conduits of Parkinson's disease. We also said that the causative factor of this syndrome is internal wind, with possible insufficiency of liver yin. Next, let us choose acupuncture points to treat this syndrome. Our first points will be the 4 confluent points of the du and its yin pair, the Zhen channels. Small intestine 3 and bladder 62 open the dumai, the sea of yang, and lung 7 and kidney 6 open the zhenmai, the sea of yin. These 2 channels balance each other. Now we have access to the dumai. We can take du 20 and du 21 points. We use them as Dao Ma technique to amplify the effects. These are excellent points for neurological dysfunction, and they treat tremors, convulsions, and aphasia. These are common symptoms of Parkinson's disease. Small intestine 3 and bladder 62 both give us access to the foot taiyang bladder channel. We can take bladder 8. We locate this point 1.5 cun lateral to the midline and half a cun posterior from du 20. This point has a holographic connection with the lower back. Thus, it treats taiyang type of sciatic pain. It also controls spasms and other neurological disorders. We have an expression in Chinese medicine: to expel wind, move blood. Bladder 8 moves blood to expel wind. Another way we can move blood is by bleeding acupuncture points. I highly recommend the book by Dean Mosher, The Complete Guide to Chinese Medicine Bloodletting. If you don't implement bleeding as part of your acupuncture practice, you're missing a lot. Anyway, we can bleed a sensitive acupuncture point between gallbladder 36 and gallbladder 37. The gallbladder channel is the yang pair of the liver channel. And we can drain the excess in the liver channel by draining the gallbladder channel. Here you don't have to be precise with point location. Find a tender point and bleed it. We can use disposable suction cups, or you can bleed spider veins, but make sure to avoid varicose veins, because bleeding these is dangerous and ineffective. Another 2 points we can bleed for brain conditions are bladder 40 and pericardium 3. If your diagnosis involves phlegm obstruction, it is possible to bleed stomach 40 because it is an influential point for phlegm. Stomach 40 is a lower point for the stomach channel, so it connects to the spleen channel. The spleen produces phlegm. In Chinese medicine, 2 pathogenic factors responsible for difficult and chronic diseases. These are blood stasis and phlegm. When we bleed stomach 40, we address both causative factors. Next, we want to balance the acupuncture points we have already selected. We chose lower points on the yang channels on the leg. We can combine these points with the source points on the opposite leg. These points will facilitate the yin qi, as yin and blood insufficiency are the root of internal wind. The yin source points on the leg are liver 3, kidney 3, and spleen 3. So we can choose the rest of the points according to the 5-phase theory. For instance, we can select wood points on the yang channels of one hand to address wind, or we can choose fire points to address heat symptoms. The wood points are small intestine 3, which is already in the prescription, large intestine 3, and Sanjiao 3. The fire points are large intestine 5, Sanjiao 6, and small intestine 5. On the yin channels on the opposite arm, we can choose points that belong to the water phase. Water nourishes wood, and we want to promote nourishment of the yin-wood phase. The water phase points are lung 5, pericardium 3, and heart 3. In terms of the frequency of acupuncture treatments, ideally you want to see your patients at least once a week. Remember, this is a long-term project. When we tap into the extraordinary vessels, the time to change Jing essence is 3 months. Your treatment program should be 3 months long. Then you can reevaluate. So, these are my general recommendations for the treatment of Parkinson's disease. Of course, you can always modify this prescription according to your style and your patient's needs. By the way, after I finished writing this article, I found a systematic review and meta-analysis published by Korean researchers in 2017. This study reviewed over 900 articles and concluded that acupuncture effectively relieves Parkinson's disease symptoms. Interestingly, liver 3, gallbladder 34, and DO20 were among the most common acupuncture points researchers used, which is very close to the prescription I just gave you. I will leave the link to the study in the footnote. So this is all for today. If you had success treating Parkinson's disease with acupuncture or have any questions, please leave your comments. I would be happy to hear from you. Thank you for listening, and I will see you next time.